Hi everybody, welcome to Healthline. I am Gregory Zarian. Merry Christmas and soon Happy New Year. Did you have a great Christmas? Did you see your family and friends? Did you call people that you weren't able to get together with? Did you keep receipts just in case you get that gift that you don't want to keep? And did you keep on working out? Did you drink water? Did you not overfill your plate? Did you have that extra cookie? First and foremost, it's okay to have an extra cookie. I did. And we also beat ourselves up over it. Well, a couple things. Next year on Healthline, we're going to share with you how to get your health intention back on and not shame you for eating a little bit more or not doing as much as you usually do. Because as always, our mission here is for you to be as healthy as you can be and have the conversation about health. So, it's Christmas time, you're wrapping gifts, you're cooking, you're doing things, you're using your hands a lot more. Your hands get tired, they hurt, they're in pain. You want to relax them, you don't, and then you end up having this shooting pain that doesn't go away, that you've had throughout the entire year and you did nothing with it. Could be that you have carpal tunnel. Could be that you don't. Could be that your hands, as I just said, are tired. So joining us from Adventist Health Glendale is Dr. Sepideh Saber, Doctor of Plastic Reconstructive and Hand Surgery. Hi, Doctor.
Hi, how are you?
I'm good, how are you?
Good, thank you.
Welcome, it's your first time here.
Yes, very happy to be here.
So happy that you are here. Doctor, out of the gate, we use these a lot.
Yes.
And we don't give them a lot of rest.
No, we don't, unfortunately.
Why do you think that is?
Well, mostly because we don't think about it. We use our hands subconsciously and we don't we don't really realize what we do with them, but we use them all the time. Whether we cook dinner, take care of our kids, at work. So we don't really take a break with them.
I like that you said we really don't think about it because along with our legs or whatever, we're always just moving. Mm-hmm. What is the one thing, because we're already heading into our first break, what is the one thing that we do with our hands that you as a doctor annoy you the most?
Ooh, that's difficult. Repetitive motion.
Okay.
And that's probably the mother of many hand diseases.
Repetitive, so with social media being so big right now,
yes.
As a doctor of hands, do you look and just go, okay, that irritates me, take care?
Swiping motion on the cell phone, video games, constant motion that we're repeating and not paying attention to.
And also this.
Typing, absolutely.
Typing, because along with just the typing, you then hunch over and then you do this, and then ergonomically, which means sitting properly, we as a globe, as a world, we're messed up, aren't we?
Well, it's just how society is these days, and we can't stop it. We have to just modify our posture,
Can you help us modify it?
I hope so.
Okay, so you know what? Here, this is what I invite you to do. Sit up. Put your feet down flat. Don't sit at an angle. Ergonomically sit in the chair, hands here. Don't pick up your phone until we come back. We'll see you on the other side. Oh, and then also get a glass of water. So do a little bit of both. We'll see you in a minute. Bye. Well, back to Healthline. I am Gregory Zarian. So I hope you're sitting up a little bit straighter. And if you did get up, I hope you got a glass of water and maybe a carrot stick. And yes, because Christmas holiday season is here. If you had a cookie, you had a cookie. We can talk about it later. Joining us from Adventist Health Glendale is Dr. Sepideh Saber. Her specialty is plastics and reconstructive hand surgery. And the conversation is all about what carpal tunnel syndrome is. Doctor, before we dive into more conversation about how much we overuse our phalanges, please give us a little bit of your medical background.
Sure. I did medical school at Stanford University, and that was followed by a residency in plastic and reconstructive surgery at USC. And then finally a fellowship in hand surgery, hand and microsurgery at NYU.
So what got you into hand surgery?
Hand surgery is great because it restores, with surgery, with medical treatment of the hand, you can restore not just form but function of the hand. You don't realize what a difference it can make in quality of life until you have a non-functioning hand. And all of a sudden your life changes, your activities change, you're limited, you're restricted.
Because we take it all for granted.
Absolutely.
We don't, as you said in the very beginning, we don't think about it.
That's very true.
And do you think it's just because we just assume our hands are always here and this is, that I'm going to be able to do all this?
Correct.
Until
yes.
we can't.
Until we can't.
I did some research earlier that over 8 million suffer from carpal tunnel syndrome. What is that?
Carpal tunnel syndrome is a compression of the median nerve, one of the main nerves that enters the hand centrally at the wrist. It is a compression and a traction injury of that nerve.
So doctor, can I see the carpal tunnel if I go like that?
No, you can't see it. Your carpal tunnel is a tunnel inside your wrist.
Okay.
The floor of it is the carpal bones, which are your wrist bones, and it is bordered, or its roof is a thick ligamentous sheath that we call the transverse carpal ligament.
Okay. Okay, so we have carpal tunnel on both sides?
Correct.
Left and right the same. So then what happens? Does the tunnel just get smaller?
The tunnel doesn't get smaller, but it gets tighter.
Okay.
As you have swelling and inflammation of the structures that pass through the tunnel, which are the tendons that flex or bend your fingers and your thumb, you can have a tighter space inside the tunnel. And with that, with the swelling inside the tunnel and with the sheath covering it becoming thicker, you have a smaller circumference and you have more pressure on the median nerve. And that's what
so it
causes
keeps on. Now, but this then goes back to what you said in the very beginning about repetitive motions.
Correct.
So,
Yes.
no, we're not born with carpal tunnel.
No.
So then we create this.
We create this. There are ways to avoid it.
Okay.
But you can't completely avoid it. There are factors that we can't control, and there are factors that we don't really know. It's not fully understood, and there are genetic components. There are components that we contribute to due to repetitive motion. There's hormonal factors that contribute. Women who are pregnant or entering menopause, water retention. Anything that can cause obesity, anything that can cause the tunnel to become tighter, anything that can cause compression and a tighter space for the nerve to travel through can cause compression of the nerve.
I love that you said obesity, because we being the most obese country in this world, over 70%, is it basically a constricting of just the tendons going to your hand? And with it being obesity, is it that much extra weight closing off the blood flow, the movement, everything is restricted?
Everything is restricted, everything is tighter, everything is, it takes more force. So that, along with repetitive motion, causing inflammation, causing stress, causing swelling of the structures inside your tunnel, will cause the nerve to suffer.
Which then is very painful.
Absolutely.
More with Dr. Saber when we come back. Don't go away. Welcome back to Healthline. I'm Greg Rees-Aaron. Did you know that Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals for 2018-2019, ranking 15 out of 133 hospitals in the Los Angeles area and 28 out of the 414 hospitals here in California. Did you also know that Adventist Health Glendale recently received their 8th A grade in a row for patient safety from the Leapfrog Group? Congratulations, Adventist Health Glendale. Joining us from Adventist Health Glendale is Dr. Sepideh Saber, and it's all about hand health. And we were talking about what carpal tunnel syndrome is. I came across a statistic today earlier that more than 8 million people are affected by carpal tunnel syndrome each year, and that it's the second most common type of musculoskeletal surgery, because back is number one, with well over 230,000 procedures performed annually.
Correct.
Do you see the numbers going up because of social media, because of computers, gaming, all of that?
Absolutely, yes. It's a large contributor. Again, everything goes back to repetitive motion and bad posture. So repetitive motion can cause a lot of inflammation of your tendons. It can cause inflammation of the nerve. It can cause the tunnel to become tighter, the carpal tunnel to become tighter, and thereby compression on the nerve. And also bad posture, sitting with your wrists very extended or flexed, not having the right setup. Extremes of motion can cause traction on the nerve, meaning the nerve becomes pulled. And
it's kind of like a rubber band, isn't it? Just the constant stretching of...
Right. It doesn't quite have that stretch, and therefore it becomes injured.
Since we've talked about this, I'm going to knock this out. Doctor sitting in a chair. When I say the word ergonomics, it's sitting proper.
Correct.
How do we sit in a chair ergonomically correct?
So you want your shoulders to be relaxed. You don't want to have them raised or too low, too high. So just relaxed shoulders.
Okay. So everybody sit in a chair. Okay, we're going to wait.
You should sit straight up.
Straight up, okay. And Dr. Saber said shoulders relaxed, okay.
Your elbows should be at approximately 90 degrees. They shouldn't be higher. You shouldn't be flexed more than 90 degrees.
Okay.
And so if your table is too high, maybe raise your chair or lower your table so that you're sitting with your elbows at 90 degrees.
At 90 degrees. Is it better to be too high or too low, or you always want everything at 90?
You want everything at 90. If it's too high, you're bending too much. And if it's too low, your arms are extended.
Okay.
And so 90 degrees is the best when you're sitting at your desk.
Okay, when you're sitting at your desk, how do you want your feet?
You want your feet planted on the floor. And so...
and most of your weight is back?
Correct,
okay.
Yes. And you want your wrists to be as neutral as possible, not too extended and not too flexed.
Okay. So then here. You know, we overdo this a lot.
Right.
What do you say to the people that work 9 to 5, but it's really 7 to 8 every day? What do you invite them to do so that they give their hands, because I know people go like this or whatever. How much time every hour should we give our hands a break?
Try at least every hour for 10 minutes.
Okay.
You know, even standing up, walking around, not sitting from 9 to 5, taking a break, having a glass of water, shake out your arms and move it. Yes.
Okay, and there's even some great simple exercises, like you stand near your wall and you have your fingers like you're a spider and you climb up and down the wall, just to have your body moving and get some energy going, because you end up, because we're like a car. We sit stagnant and we don't move. Okay, so 90 degrees sitting up, feet flat.
Feet flat.
If somebody wants to sit down and cross their legs, do you recommend crossing legs or no?
I mean, sit comfortably.
Okay.
You don't want to
sit like a robot
and spend all your energy thinking about sitting. It should be comfortable.
Okay.
It shouldn't be. You shouldn't have your tiptoes touching the floor. You don't want to be in an uncomfortable position. If you're comfortable, most likely you're ergonomic.
Okay.
You can get special ergonomic keyboard, a mouse that's comfortable and that doesn't cause you to bend or extend your wrist too much. So these are little tools that you can use.
So much time is done here. What is the best way to be on your phone and text? Is there a way because this is bad.
This is bad.
So
yes.
what would you invite us to do in regards to how to be on our phone?
Try to limit the amount that you're on your phone.
Great.
And if you have to be on your phone, the best way is to maybe get a phone that has a bigger screen.
Okay.
And maybe use voice activation on your phone in order to write long emails if you have to write a big email on your phone. There are tools that allow us to not be hunched over and look at our phone 24/7 like this.
And what about this though? Is it better to, going back to having the 90 and holding it up?
Absolutely,
Okay.
yes. Mm-hmm.
But then again, make sure that your hands are not so overextended.
Right. There are smartphones now where you can speak into them and they recognize your voice and write the text for you. So that's better than if you type long passages.
Are you finding that with the millennials, per se, the younger generation and younger, more people are suffering from carpal tunnel and neck and back problems at a younger age?
At a younger age, definitely. Yes, that's correct.
And so what do you say to them?
I try to teach them about activity modification and to do less harm to their body.
And put down the phone and live your life. Not everything is about social media. What's sad for me is more people will take a photo of an experience instead of being in the experience. So, put down your phone, be in this experience. We're trying to make you healthy. We're trying to make you healthier and have your back not hurt and your hands not hurt, and trying to help you not have carpal tunnel. More when we come back, don't go away. Okay, sit up. We'll see you on the other side. Welcome back to Healthline. I'm Gregory Zarian, and I am joined by Dr. Sepideh Saber from Adventist Health Glendale. Dr. Carpal tunnel affects more women than men. Why is that?
Women have more water retention.
Okay.
With pregnancy, with menopause, with hormonal changes that are more common in women, again, there will be a tighter space in our tunnel as our tissues swell up more.
Are there, massaging your wrists and doing that, does that help? Does that open up the space a little bit? Pulling of the joints and the knuckles, some say can give you arthritis, some say can't. Does any of that help with anything hand-wise or no?
Medically, I don't think there has been any research proving or disproving it. If it helps with sensation, if it makes you feel better, there's nothing to, no harm done.
Okay.
But I don't think that necessarily carpal tunnel can be reversed with massaging.
Okay, so signs of carpal tunnel are pain, tightness.
A burning pain.
Okay.
Worse in the mornings.
Chronic.
It's initially it can start on and off. It's intermittent, and as the symptoms get worse, you have a loss of sensation. You have numbness and tingling in your thumb, your index finger, your middle finger, and part of your ring finger. The symptoms can be worse in the morning. People try to shake out the pain. It's a burning type pain. And then slowly. But
it's not the same thing as like, oh, I slept on my shoulder wrong and there's that numbness.
No, because
totally
it's different. That goes away. With carpal tunnel, it comes and goes initially, and eventually it stays.
Okay.
And it's a constant numbness and tingling sensation. And eventually, as the disease gets worse, the hand becomes more weak. And so people start to drop objects.
Just say I come to you and I'm suffering from carpal tunnel. What are my options?
It really depends on the severity of your symptoms. If they're very mild, initially we try to treat things medically. I would give you a wrist brace that would allow you to keep your wrist in neutral position, especially at night. When you're sleeping, you may not realize, some people sleep in fetal position with their wrist bent. And again, that can increase the pressure and it can increase traction on the nerve.
So you just want it to be in a neutral position.
Neutral position, resting
and so that
position.
just allows the tunnel to get more energy, do what it's supposed to do.
To get more blood flow, get less compression, and yes, so to allow the nerve to rest. And I can give you anti-inflammatory medications to bring down the swelling and thereby also increase the volume within the tunnel.
Just say you look at me and say, Gregory, you have to have surgery. What does that look like?
Surgery can be done in two different ways. There is an open release of the carpal tunnel as well as an endoscopic release of the carpal tunnel. The classic way is an open release. It is an incision right here in the palm of your hand, releasing that tight ligament that's the roof of the carpal tunnel that provides pressure onto it. And by releasing the tunnel and then closing the skin over it, we have freed up the nerve.
Because I was pointing here, I don't have it obviously, I was pointing here, but it's all through the hand then.
It's in the palm.
It's
yes.
it's in the palm.
So the incision is right here in the palm. The tunnel does go into the wrist as well.
Okay, so then okay.
But that's released under the skin.
Got it.
The skin incision is only in the palm.
I have surgery. How much physical therapy then is following that?
Physical therapy is not necessary if you don't have any stiffness following surgery.
Okay.
Physical therapy is mostly for people who have developed a little bit of stiffness after not moving their hand for a while. So if you, after surgery, have not gone right away back to using your fingers to their fullest capacity, you may develop a little bit of stiffness. And the stiffness can also be at the wrist level. And so physical therapy just gently brings back all the range of motion to its fullest. But it's not everybody will need physical therapy after carpal tunnel release.
And just to clarify though, arthritis is more pain in the knuckles.
Correct.
And not arthritis,
in the
nothing,
joints.
And in the joints, but nothing in the hands and the palms.
Arthritis, you can have arthritis in the wrist bones as well.
Okay, but it's more painful because carpal, as you said, is more of a burning.
It's more of a burning pain. Nerve pain is different from arthritis pain. Nerve pain is more of a tingling, burning, and sort of a hot and cold sensation.
Okay. What do you want us to do in regards to taking better care of our hands?
So take a break from repetitive motion activities. Take a break from activities that put a lot of that put your wrist in extremes of positions. So you know, yoga is great for the body, but we're not meant to be standing on our hands. And so if you put your wrists in extreme positions, extreme extension, extreme flexion, regularly, and we're not talking about once a week, but regularly, and if you don't treat your hands well, if you continuously do the same motion over and over, you will develop some tendinitis, carpal tunnel, pains in response to that.
Is tendinitis the same? What are side effects of pain? In regards
tendinitis is similar. It's also caused by repetitive motion. It's an inflammation of your tendons. And you know, with carpal tunnel, you can also have an element of tendinitis as you have tendons running through your carpal tunnel that become swollen and injured due to repetitive motion.
Final question, doctor. What is your wish for us on a whole in regards to whole person care and whole body health from this year into next year?
I would say to take everything in measures. Do everything in small amounts. Don't do anything in extremes. So when you have some sweets, have a cookie. Treat yourself, but don't have the whole box. When you have you know, when you have to work, obviously it's sometimes not under our control, but take some breaks. Don't do the same activity over and over. You know, don't sit in a position that's uncomfortable for the entire day. Stand up, move around. Just, you know, treat yourself right.
Thank you so much for being here.
Thank you for having me.
It was an absolute pleasure, and together, we say thank you, and then the wave.
Exactly.
So you heard it from Dr. Saber. Do things in moderation, and here's what's great about working and living our best life is it doesn't have to be the same thing every day. We can mix it up. We can stretch. We can stand up. We can do different things, because if we overdo it, we then get hurt. We then may end up with carpal tunnel. We may not be at our best, and then we get hurt, and then we have to put a pause and just do it in moderation, as we say every new year. Baby steps and gradually get there. It has been a pleasure having you with us once again for another year here on Healthline. Our mission is to have you be the healthiest you can be. You can find us on all types of social media. You can follow us on Facebook at AH Glendale, Twitter at Adventist Health, on LinkedIn, Adventist Health, and you can always find me on at Gregory Zarian, and the website for Adventist Health is adventisthealthglendale.org. Remember, the most important conversation you're going to have is about you and your health. So why not talk about you and your health now? Have a great new year. We'll see you in 2019. Thank you for being so great to us. I'm Gregory Zarian. Be safe, be well, and tell someone you love them.